Hello, welcome to CIO Leadership Live Australia. I'm Kathy O'Sullivan, Editorial Director for Foundry in Australia and New Zealand. My guest today is Suma Shivalingaya, who is the Chief Information Officer at Eastern Health. Welcome to the podcast, Suma. Appreciate you being with us today.
Thanks, Kathy. Thanks for the opportunity.
Great stuff. And look, really looking forward to hearing more about you and Eastern Health. So take us back to the start. Tell us about how you got your start in technology. And I guess what have been some of the highlights of your career to date?
Thanks, Kathy. So my interest in technology stems from my childhood, seeing my parents. So my initial childhood was in Canada, and seeing my parents carry two big processes. This is in the 1980s. From Canada to their hometown, and started off teaching computer to students. So they started their coaching classes. So since childhood, I had an interest, and I grew up learning DBase, Pascal, Opus 1 to 3, and all of these technologies. Since then, I joined and did my Bachelor's of Computer Science. And then I came to Australia, did my master's in RMIT. Started off my career in healthcare as an application developer, and then moved into different sectors, finance, utilities. Then I moved into project management, portfolio management, then took up leadership roles in local government, then had an opportunity here at Eastern Health to join them. And that's how sort of I've gone through the ups and downs and the roller coaster ride of technology.
Well, great that you had that from the start with your parents teaching IT. So look, as you said, you're now Chief Information Officer at Eastern Health. So tell us a bit more about the organization. What's its purpose, its mission, and how do you and the team support that?
Definitely. Eastern Health is one of the largest health services within Victoria. We have around 60 plus locations, and we have 3 emergency departments, around 100,000 or million episodes that we work through. And also we support around 18,000 staff and a large catchment. This spends into emergency services, allied health, drug and alcohol. So mostly a lot of services and some amazing work that everyone does here at Eastern Health. Within ICT, myself, the CIO, and one of our co-program directors, who's the CTO, we both manage the ICT department, which consists of a cyber team. We look after applications, infrastructure, the networks, and also a solution architecture team as well. So that's sort of where we stem and where we manage all of these aspects within technology.
So you've also worked in utilities, you said, and finance. So tell us a bit about what you've noticed moving into the CIO role in the health sector, even though you did start off your career in health. So how does health differ, I guess, from previous industries that you've worked in?
That's a very good question, Kathy. Health is very complex, and we also have a saying here that there's never a dull moment in health. I'm a very action-oriented person. I like new things and new challenges and innovation, and there's ample opportunities in health in working through those challenges, especially in the health sector. There's multiple domains and enterprise systems which are connected with each other. And we get the opportunity to actually see a good outcome with technology deployed, which will help patients and the healthcare professionals. So a very satisfying role compared to other sectors, and in trying to help people in doing their job day to day while we roll out these modern technologies.
So talk us through then some of those achievements. You know, as you said, it's a very rewarding job in a sector that cares for so many people. So what have been some of the notable achievements of your team at Eastern Health in recent times?
So there are many. So hopefully I cover some of the important ones. So we have an incredible team here within our ICT department. So with the help of our Exec Director of Digital Health and our co-program director, we developed our ICT strategy in 2022. As part of the ICT strategy, our roadmap defined a lot of improvements within our team, which is improving our skill sets within our team, modernizing some of our legacy platforms that we had, and enabling technologies for the future. So with those three aspects, we worked through many initiatives that we had to embed and roll out. So we were successful with a couple of those modernization initiatives, the Microsoft M365. We are embarking on a network uplift and modernization, and there's ample cybersecurity improvements and maturities that we have put in place. So this was something that we proposed as part of our strategy, and with the support of the CEO and the board, we were able to start that journey, and we are continuing that journey. We're in the third year now, but we're continuing on that journey. We also had a lot of opportunities to improve our governance framework within the ICT, uplifting that, introducing a centralized PMO tool so that we could actually measure the resourcing and allocate appropriate resourcing across the organization, and also work on compliance requirements for the organization. So there are a lot of initiatives that we can talk about, but that was the key aspects of introducing the strategy and improving our skill set within ICT to support the business.
So just building out on that a bit further then, can you tell us how you're using technology to enhance that patient and staff experience?
Yes. So in terms of, we put patients in the center of everything we do, in terms of supporting the clinicians and also the patients. And some of the technologies we were using were quite old and legacy technologies, which also is a cyber risk for us. So we had to modernize and provide more efficient technologies for staff to support their patient needs and also do their jobs properly. So we were able to introduce some modern platforms for them, establish more collaborative tools, and we also introduced this enterprise contact center as well, which helps associate and bring everyone together. So that was some of the aspects that we do. And also from a cybersecurity perspective, the governance that we put in place, we also conduct regular simulation exercises to help with that. And also the awareness, which is quite important in this space to support the staff members and also within ICT to get trained in this space. So there's a lot of things that we have done in that aspect, which supports our patients and also our staff members.
So you touched on that a bit there, but I mean, you've mentioned earlier that you've got 18,000 staff, and I'm sure many more thousands of people that you look after. So how do you ensure that adoption of those new technologies that you roll out? And I guess what kind of role does your team have in lifting digital literacy across the organization, especially when you're dealing with frontline staff and people who may not be behind a laptop all day, but actually out with patients?
That's an excellent question, Kathy. We always are faced with this challenge, and we do have various different types of stakeholders as well when we roll out technologies. So we take change and adoption to be very critical in terms of all the technology projects or technologies that we roll out. In some of the modernization initiatives, we have worked on few initiatives from a change perspective, which is called New Ways of Working with the Microsoft platform. What that means is that we understand the workflows which people are used to in a certain way, which is manual, and how do they adopt into the new workflows with the new technology. So we conduct a lot of training, and we also give them a quick tips and tricks in terms of what they can do in those spaces to adopt them to the new technologies. Another initiative that we've just started now is Digital Champions. This initiative is basically across the organization to identify who are the super users who really are change agents for us and help us through this journey in supporting others or their co-workers in how do they actually adopt to the new modern technology. So this is something that we are just introducing, and across, it could be a cyber initiative, cyber awareness program. It could be a new modernization tool that we're launching, or it could be an existing tool that we have launched, and there are still some workflows that need to be defined. So this is how we actually are promoting and uplifting the digital literacy. We do also conduct regular surveys to assess where we are at and also improve on this and consider those feedback for what other initiatives we can bring across to build the digital literacy.
So Suma, cybersecurity is a challenge for every CIO, no matter what industry you're in, but particularly in healthcare. So what are your biggest challenges when it comes to maintaining cybersecurity and protecting organizational and patient data?
It's a very good question, Kathy. Cybersecurity is an ever-changing landscape with the threat increases every day. So an interesting story is when I started at Eastern Health, we were hit with a ransomware attack. And pretty much all systems were down as we spent weeks to recover from that. And since then, we have a well-established 3-year cybersecurity roadmap. We have done quite a lot of new things in that space to protect Eastern Health and keep our data and patients and staff safe in that manner, protecting our systems. So there's lots to do in this space. We do conduct regular simulation exercises as well with the exec team and also within our staff as well and with stakeholders. And also from a cybersecurity awareness perspective, we have multiple programs running, phishing exercises running that we are able to train and support our staff in this space. We do group our initiatives based on the risk landscape, and we work through them from a priority order to reduce that risk to Eastern Health. But it is a very challenging environment.
Absolutely. And it's a team sport. Cyber is, there's never an end to it. It's just something that we have to continue to keep an eye on. So then, Suma, tell us a bit about, what role, I guess, partnerships with the likes of IT vendors, technology vendors, MSPs, what role do they play in your IT strategy? And what does a good partnership look like to you?
We have a lot of applications, Kathy, that we support at Eastern Health, so probably around 200 plus business applications. Most of them are supported by vendors, so we rely on vendors quite heavily in terms of providing us support. What we expect from the vendors is to actually help us through the journey of filling in the skills gap that we have, and also through their success, also see our success in implementing a lot of things in terms of their applications and supporting us. We run emergency departments and we actually have to support the business throughout their journey. And we do require support in that sense to keeping the lights on all the time with the BAU work. And I think we seek vendor support in that sense to support us through that journey.
So then there's a lot of noise around things like AI. What emerging technologies do you think will have the biggest impact on your industry? And what is your approach to things like AI? Do you see value in it for you and the organization?
Absolutely. AI has been one of the key topics of discussion within healthcare sector as well. So we have defined a governance framework across AI. Basically, from the Department of Health Controls and Direction, we defined our guidance and controls across AI. We also managed to review the cybersecurity risks which are associated with AI. So we have monitoring tools in place which can help us through that journey. Since it is actually new and we are still working our way through how do we assess and how do we allow actually the utilization of good AI tools. So we are embarking on some use cases with few partners so that we can trial this out in a controlled way. And of course, looking at the risks and managing and balancing that in the clinical space. We are working through that journey, but definitely something which is something we are aware of, which could be a huge benefit, but we also need to be aware of the risks that are associated with this as well. We are working through some good clinical use cases, which we are trying to measure and see if that would be a huge value add into the organization. But starting on this journey and developing and looking through the governance structure.
So what then do you see as the biggest challenges facing CIOs and other IT leaders in the health sector in the coming years in Australia?
Well, Kathy, there's many. But if I have to name a few, I think one of the key challenges are around interoperability in terms of bringing systems together and having a centralized view of most of our enterprise systems. We have got really good leadership from the Department of Health with their new Chief Digital Health Officer and direction as well from a digital roadmap. So we are working through some of those initiatives, and that probably will help us bring and align a lot of these siloed systems together. One of the other challenges is around resource retention. So we work through, upskilling our resources, and also there is a lot of demand in certain areas as well. So that's something which is an ongoing challenge for us to motivate our staff and keep our staff working in the health domain. And I would also see that the cost optimization initiatives that we have to work through in this economic state is also one of the key challenges for many CIOs in this sector.
So then, Suma, how do you prioritize digital initiatives within a resource-constrained environment like health? I mean, how do you line up that tech strategy with the overall business strategy? You mentioned earlier about the governance that you've got in place. Is there anything else that you look at when you're prioritizing your digital initiatives?
Yes, we definitely have a prioritization model that we look at, and we also look at the resource availability. So we've been able to establish a centralized tool where we monitor all of the initiatives that come into ICT. We work through something which is called as an enterprise design authority to make sure that we can look at proper solutions. They go through the IT principles which are assessed. And also we look at the resource capacity. If we have the capacity to deliver these type of initiatives that we are getting through the front line or the front door. So this is some of the things that we look at to then measure when can we do this critical piece of work versus, do we need additional help or support from recruitment or other resources? And then we embark on that journey to manage that. So from a governance perspective, we have a centralized tool that manages that. And with reporting, we can actually look at how much workload we can take on board. We are still improving in this space, but at the moment, with the defined roadmap, we prioritize initiatives along with the new critical initiatives which come from the business, so that way we can manage our existing resources and not overload them with a lot of initiatives that are coming through. So that's how we kind of have that balance.
And then finally, what's important to you in the months ahead? Any other exciting initiatives in the pipeline?
Months ahead, there are many exciting initiatives in the pipeline. We're looking at our cloud migration strategy. We are looking at AI, use cases in AI, and also optimizing some of our existing manual workflows and automating them as well. For me, it's important to upskill our team. So I'm more of an action-oriented person. So I like to get involved, and I love skip-level meetings to understand what is happening within the team. We want to invest in our people, so we want to train them, give them more opportunities to learn and grow within their teams and in their careers as well. I'm also a mentor within RMIT and Monash, and especially around getting more women into technology is also one of the things that I'm quite keen in understanding and promoting as well. So basically want to roll out more modern technologies within Eastern Health to support our goal of healthier together. So that's my key focus.
Well, I look forward to catching up with you in the months ahead and hearing about those initiatives, and especially that lofty goal of getting more women into technology. We definitely need more women in technology. Suma Shivalingaya, Chief Information Officer at Eastern Health, thank you so much for your time and insights today.
Thank you, Kathy.